This is the first page of my psych notebook, and I just started. Last minute cram 2 days. As a med student, eventually sometimes life gets a hold of you, you procrastinate, etc., etc. It happens to all of us. Times like this is when you need some coffee. I can't promote cramming because cramming doesn't always work out for everybody. For one day, just do your best. So what do you think my notes look like? Notes, very clear, very simple, straight to the point. You just put panic disorder, like, for example, some chest pain. You treat it with SSRI. Then I put versus, right? What I chose, buspirone, which treats general anxiety disorder. These are my notes. I just show you how I build on these little notes right here. So I did another question, right? What is this? Question 5. Basically, in the explanation, I saw more things about panic disorder and generalized anxiety disorder. So I just added some more tidbits, right? You see here, I added greater than 6 months. And then for panic disorder, recurrent and unprovoked, because get some more to build on these last minute notes. Strategically cram. Notes here, and let's just dive right into this video. The first thing that you must prepare yourself if you're preparing for the psychiatric shelf rotation and shelf exam is that psych is kind of a giant mixture. You have to think about it. Almost every patient that comes into the hospital and has to stay for extended stay could potentially develop some psychiatric problems, some depression, some anxiety. So potentially you are seeing post-op patients, you're seeing people that came in for pregnancy deliveries. Fortunately, my preceptor is dual certified. She is a psychiatrist and an internist. So she's internal medicine and psychiatry, meaning our mixture of patients was even more broad. But for the resources that I used, I kind of kept it simple, like all my other shelf exams. I absolutely swear by NBME and UWorld. Now, NBMEs, you want to do all of them and you want to take your time. The reason why is because NBME, it's not the question that you're trying to memorize. You're not going to expect to see that same question on the exam. Absolutely not. If that happens, it might be 1 or 2. The satisfaction that I get in taking NBME exams, it's in digging deeper. So they give you a vignette, right? Very small. And they give you almost 4 to 5 answer choices. Know all of those answer choices. Know why they are incorrect. Make sure that you dive deep into everything that is on that question, because they take the answer choices and they change some of the wordings to make it now the correct answer. Okay, so some other, I'll pick that up later, but some other quick resources that I tried for the very first time with this shelf exam. I tried Divine Intervention, loved it. It's gonna take you some time. I think it's about a 2-hour video if I'm not mistaken. I did Emma Holiday, loved it. And I tried Dr. Hayud for the very first time. Again, loved it. Now, in my assessment, do I think that you have to do all 3 of them? Completely honest. The thing with resources is that yes, Emma covered some things that Divine didn't, and Divine covered some things that Dr. Hayil didn't, but UWorld covered it all, and then NBME covered up the rest. Okay, so it's getting super loud in this background, but I just wanted to make sure that I touched on my schedule before I finish this video. So in terms of schedule, we about 4 to 5 hours for those 3 days. What we did is you pre-round on the patients, and then you go see the patients. We did this at night. Her shifts were nights because she told us that she noticed with psych patients, it's at night that they want to talk. It's at night that they feel lonely and they need somebody, a last minute comfort before they close their eyes. Godspeed. If you're taking psych, good luck. You got this, and believe in yourself. Peace for now.